My hope would be that we go from this very transaction-based healthcare system, where you get paid as a doctor per visit and per patient you help, not even help necessarily, but see you have in your consultation room, that we go from that very transaction-based, where you actually just earn more money if the patient is not cured. That's the fact, right? To a system which is much more outcome based.
Herzlich willkommen zu einer weiteren Folge unserer Podcast-Reihe German Healthcare 2030. Das Ziel dieser Podcast-Reihe ist es, über die Zukunft des Gesundheitssystems zu sprechen und vor allem mit Blick auf das Jahr 2030. Und das machen wir, indem wir spannende Persönlichkeiten aus dem Gesundheitsbereich einladen. Mein Name ist Julian von Invenion und ich freue mich, die heutige Folge moderieren zu können. Ich wünsche dir ganz viel Spaß und los geht's. Welcome to this new podcast episode of the German Healthcare 2030 podcast. Today I'm extremely happy to welcome Anne Cathrine Fleischer as a guest. Anne is CEO of the Leo Innovation Lab and Leo Ventures, which is the health tech VC of Leo Pharma. Many might know Leo Pharma, which is one of the biggest pharma companies in Denmark and has a strong footprint in dermatology, bone remodeling, and thrombosis. And as the CEO of Leo Innovation Lab and Leo Ventures, Anne has, of course, a very good overview of the current trends in the healthcare space, and in particular, of course, in the digital health and health tech area. Anne sits in the board of various very well-known startups, like, for example, Skin Vision and ClickKit, and also in various associations, like the Chamber of Commerce in Denmark. I was extremely excited and looking forward to this podcast because I think Anne can provide not only a very good understanding of the current trends, but also she has insights on the intersection of pharma and startups, and also knowledge on what digitization in healthcare looks like in Denmark, which I think is probably one of the most advanced countries when it comes to digital health solutions in Europe. So, Anne, thanks so much for taking the time. Extremely happy to have you in this podcast. And I would say we jump straight into the questions.
Sounds
Great.
good, Julian, and thanks for having me.
Great. So I already gave the introduction, so we already know what you do. But what would be quite interesting also for the audience, when you take investments with Leo Ventures, for example, what is your general perception, your thinking of the future of healthcare, and what do you focus on?
Yeah, so that's a good question. So how we have been assessing and evaluating other startups, but also internally, which projects we wanted to develop in-house ourselves. We have been focusing a lot on how the patient journey looks today. So from when you discover something in your skin, we have been focusing on skin issues. When you discover something in your skin to you are cured, what happens? And if you can at all be cured, because many of these diseases are chronic. But what happens to you? What pain points do you go through as a patient? So our mandate has been from 2015 to really dig into these pain points and how we can solve them to create a better future patient journey where you have better access to treatment, faster access to diagnostics, and in the end, better personalized treatments for you to move on in your life and not focus too much about your skin disease. So that has been our mission from the beginning, whether we have invested externally or whether we have developed projects from our own incubation unit. So that is future. That's the future lens we have had on from the beginning, really to disrupt how it is today. Some of these very linear ways of thinking to being much more agile, much more exponential thinking, so that we don't just improve 10%, but rather 10 times what we see today.
Very interesting. I think also, of course, a very good vision that you have. I'm always interested also to understand the strategy of a pharma company in this regard, because it is, of course, not is a non-core business basically now to go to startups, invest there, maybe also at some point in time acquire them, or anything else in this regard. It's not this typical pill business, you know. So, what is your strategic thinking behind this endeavor?
Yeah, so when we started establishing the innovation lab in 15, we saw a world where we saw the big tech companies were getting closer to the healthcare systems. We saw how data would be king in the future, um, and we also saw that you can have the best pharmaceutical products on the shelves, but what if people don't have access to these very good products? Maybe they can't afford them. Maybe they just don't use them as they were designed to be used because of lack of information, maybe because of lack of motivation. So we saw that there were many elements um, selling pharmaceutical drugs that was not thought into that whole equation. So we wanted to go above the brand, above the pill, as you say, to understand more broadly what if we can impact all patients, for example, with psoriasis in the world? That population, that's the interesting population for us. And being a foundation owned company, we can have the long term vision. So that was what we did. We wanted to understand within skin how can we help people achieve healthy skin, no matter whether they are customers today or future customers, um, and how can we impact their lives for the better. And that is, of course, a bit philanthropic to think that way, but that's probably due to our ownership structure. We were allowed to do so, and we can see the last couple of years here that many more pharmaceutical companies have been thinking that this way, also to understand how can we build, develop data on our users to understand them better, to provide them with better medications in the future. So you can say there are many ways in having this more philanthropic view, but I think at the end of the day, if we take good care of patients, the business will follow. Then it's just a matter of, you said it's not a core business. No, it's not. But what if it can be a really good sister company to the existing company? So these have been kind of that that have been our way of thinking about this. And I think that has been super motivating for me at least.
Actually, in your answer are many very interesting points. First of all, I think that is special about Leo Pharma. You're in some way philanthropic strategy, also basically based on your ownership structure. For everyone in the audience who doesn't know, like Leo Pharma is, as I understand, owned by a foundation. It's not the typical shareholder structure that we know from other pharma companies. And also, basically what you say regarding the change of the business model beyond the pill. Something very important probably for all pharma companies. And I think, at least from my perspective, something that is required for new digital health solutions to become successful. Because obviously, pharma companies are one of the strongest players, stakeholders in the healthcare system. And getting support from these strong players is quite important. And also, even stronger, getting at least no this support would be quite important. So maybe you give us a better understanding. How does it work? Do you see Leo Ventures more as a partner for your startup, or as basically an early way to get into the startups and then connect them close to Leo Pharma?
It is actually a bit of a mix. We are both a supporting unit for the startups. We help them as a strategic advisor, having the many colleagues in Leo Pharma. So if they have questions regarding, for example, regulatory access in Germany, we always have a specialist, right? So we can drag knowledge back and forth. We have built it as a unit on the side of the core business, also to do some de-risking, because it's clear when you invest in companies between pre-seed, seed, Series A, some of them will go down. Um, and being affiliated with Leo, we wanted to only take all the benefits from that and then take the risk in a separate company. So so this way of doing it, putting it on the site, means that you can still transfer knowledge. You can still be very supportive. You can also be very practical, supportive, like providing an office and back office functions and legal support and financial support and stuff like that, which then the startups can buy from us. But also grouping investments in a portfolio where they can help each other. Maybe one company have just dealt with the new algorithm in Facebook, and then we can tell the next one how to do this smart, because they're not in that way competing that much. So we have made it in this structure. I know some of the other big pharma companies do it a bit different. They would probably put it one level up. So in our case, reporting directly into the foundation. But we have done it this way to ensure that there was a free flow of knowledge between our startups, and not free flow, but when it makes sense, confidentially wise, then we have put it here. And I think for the time being, it has been a good place to put it. If we were to invest much more money in the future, we would probably put it one level up.
Very interesting. Thanks so much also, yeah, for giving this level of detail in this regard. Something I'm, of course, quite interested in, because this podcast is called German Healthcare
Yeah.
2030. And I mentioned already in the introduction that you are from Denmark.
Mhm.
I assume your system, at least from my understanding, is much more digital than ours, which is not difficult. But do you have a perspective on this? Like, what will change in the future? What can be done better?
Yeah. So I'm happy that you think that the Danish healthcare system is much more matured. In that way, I'm not always convinced actually, but I have also, because I have high hopes. Of course, we saw in the COVID crisis, or healthcare crisis here, that we were very digitalized, and we had all systems in place in a very few weeks. Also because we are a small population, of course, but and only having a very simple healthcare system in that respect of being 100% public. Um, so we can actually very fast implement new ways of working and digital tools. But what we see is, having the startups in my portfolio, is that often institutions, they can be quite keen on testing out or trying out. But when we go to the scaling phase, where we go from maybe one hospital to a full region or the whole country, then we get into the barriers of GDPR and data process agreements across regions and stuff like that. So then suddenly Denmark is not that agile. So what we see often is that we can prove our concept in Denmark, but when we are to scale, actually Germany is a much better country. Um,
Oh, okay.
Especially when we go privately. But it is like I see it this way, that in Germany, maybe because of the whole reimbursement structure and the different view on this, that physicians are actually, some of them, of course not all, but some of them are much more willing to try things, because they can see eventually that they will be reimbursed. um,
Mhm.
and so that openness is very different in Denmark. So we actually see Germany as the scaling market. So we tested here in Denmark. We built the products in Denmark. Maybe we do some pilots in Denmark, but when we go scaling, we see Germany actually as a much better country.
Oh, that's very interesting. As I said, I mean, that's the first time that we have this outside-in perspective, and it's always good to hear that there's also some positive view on the German healthcare system.
Yeah,
I think we internally not always see it this way. But now, when you think of the future, I mean, you are affiliated to a pharma company. My understanding is, by nature, pharma companies try to cure disease, basically help sick people. Nowadays, we always speak about we should go from a sick system to a health system,
yeah,
try to prevent.
yeah.
So, What is your perspective? What will change in the next maybe 10 years? And where we will be in 2030?
So I have a hope and a wish. I'm not sure it will happen because the systems are extremely rigid. But my hope would be that we go from this very transaction-based healthcare system, where you get paid as a doctor per visit and per patient you help, not even help necessarily, but see you have in your consultation room. That we go from that very transaction-based, where you actually just earn more money if the patient is not cured. That's the fact, right? To a system which is much more outcome-based, so that you as a doctor get a fee if you handled the patient as smooth as possible and went from sick to health as fast as possible. So you have patient journeys that are as fast and agile as possible because it's built of data. You know exactly when Julian is entering the room. You know all his data. You know exactly how diseases have been running in the family. You also know his current environment. You know how much his Fitbit has been tracking the steps. You know what kind of food and nutrition you have been exposed to have a much more holistic approach to the person, the individuals. Having that, you can go faster to a better outcome. And this is, of course, a very ethical also discussion because when is it surveillance and when is it good data of interest? But having a much more outcome-based system would, I think, ensure that we can cut a lot of like waiting times down and ensure better access. It also will that system that I'm dreaming of would also see patient they are at their worst state. So if, for example, if you look into how you go to a dermatologist having a skin issue, then you book your appointment when it's pretty bad. It can actually become even worse, but the time slot you get by the physician or the dermatologist, that's not necessarily when the disease appears the worst. So imagine you at Christmas time you are stressed, your skin is flaring up. After New Year's, you finally get through to your GP and you get an appointment there. He does not know what it is, so he refers you to the dermatologist. But then the waiting times is like 4 months. So you get an appointment in June where the sun is shining, you eat better, you do your much more physical training in good shape, maybe compared to how the winter state was for you. So suddenly you have a holistic picture that has totally changed. And of course, also your skin has changed. But that's where you have your appointment. So you would need to show a picture of how did it look when it was really itchy and really red. And today I'm actually doing quite fine, but can you prescribe me something if it happens again, right? And that is, in my view, that's waste. That's waste of good physicians' hours, not to see patients when they need it the most. So that would also be a hope for me in 10 years, as you say, when we look back. And this whole way of thinking, future back methodologies, that is what we should use more when we provide the healthcare systems with solutions and help them in that loop, help them think that through, so that they can become ambassadors for this change. Because it is clear that will change jobs, it will change maybe salaries, it will change a lot, but it's needed to have healthcare systems that can take in the demand that is growing year by year. We get older, we get more sick, we get many more lifestyle diseases, and the lack of healthcare professionals are also increasing. So we need to do this differently. So I'm happy for your question.
That is an extremely interesting explanation. Whew, sorry, I think I should drink something, but that was extremely interesting. Thanks so much, Annie. Because it was, first of all, very detailed, and I really share your vision. Having this sort of continuous care, basically. I just spoke to a cardiologist, and he also explained to me, when the patients come to me, it is extremely difficult to have on this specific day the problem that he always describes to me. And when you gave the example of the Fitbit. People are already measuring their health. At least many people do this on a continuous basis. And I think we should start to consider this data in some way. So very, very interesting. But I think also it really demands a lot from all the different stakeholders. On the one hand, the doctors, but also the insurance providers, because they have to change their reimbursement system. And at the end of the day, also the patients, because they should track their health on a continuous basis. Otherwise, it doesn't really work.
I agree. Yeah, many important stakeholders that whom all needs to take some risk and to make this disruption which is needed.
Yeah, absolutely. Thanks so much, Annie. We are already at 20 minutes now, and I could really continue talking with you for probably half an hour. Extremely interesting insights that you bring. Really, thanks so much for taking the time. Thanks so much for sharing also the insights from Denmark. I wish you good luck with Leo Ventures. I'm always following this with quite some excitement, and hopefully see you again maybe in 10 years in this podcast, and then you will see what it looks like.
I would be happy to join.
Great. Thank you, Annie.
Thank you.
Nun, zum Abschluss dieser Folge hoffe ich zuerst einmal, dass sie interessant war und bedanke mich fürs Einschalten. Ich möchte gerne auch noch ein paar Worte zu Invenion sagen. Bei Invenion verfolgen wir das Ziel, die Digitalisierung des Gesundheitswesens voranzutreiben und unterstützen von der Strategie bis zur Produktentwicklung. Für mehr Informationen besucht gerne unsere Webseite unter www.invenion.io, wo ihr uns natürlich auch gerne kontaktieren könnt. Ich hoffe, ihr schaltet das nächste Mal wieder ein und freue mich schon auf den nächsten Podcast. Alles Gute bis dahin und tschüss.